My name is Dr. Tamisha Denis of Modern Smile and Implant Center, and today we're going to be talking about all-on-6 dental implants. What exactly is all-on-6 dental implants? Now, if you come into my office, most of the time if we want to describe a form of treatment that I'm requesting or recommending, usually I'll show you a model. So let's look at a model of what all-on-6 dental implants are. Before we describe what are the various reasons that someone may consider doing an all-on-6 dental implants, let's just look at a model and kind of run through what it looks like. Let's take a look at this model demonstrating an all-on-6 dental implants. Now what you're looking at from the top is the crowns that go on top of an all-on-6 implants. And this is a clear model, so let's imagine if you had gums and bones and a face, you wouldn't be able to appreciate this, but if you look closely you can see 1, 2, 3, and on the left side 4, 5, 6 dental implants supporting approximately 12 crowns. Now, in a moment I'm going to remove this. However, once we place the dental implants on and put the crowns on top of that, that is no longer removable. So if anyone looked at you, they would think that these were your teeth. They would not think they are dental implants or denture, anything like that. So 6 implants supporting 12 to 15 teeth. Now let's talk about the different circumstances that would cause you to need to consider to do an all-on-6 dental implants. Now most of those circumstances are just that simple. We have no more good teeth left. There is no teeth in order for you to continue to maintain your natural teeth, and therefore we're considering doing dental implants to replace all of your teeth. That may be all of the teeth on the top, that may be all of the teeth on the bottom. Now, one of the very common primary reasons that I speak to people about doing all-on-6 dental implants is when they have severe periodontal or gum disease. Now, periodontal disease is very devastating, and if you look at some of my other videos, I show illustration as to how over years, because it takes quite a bit of time, that the bone continues to deteriorate around the teeth, causing the teeth to look longer, the gums to recede, and eventually for the teeth to start to move. And we call that in dentistry mobility. Now the reason that mobility is so bad and all the gum recession and bone loss is so bad is because what it does is eventually we cannot add that bone back, and it starts to become painful for those teeth to start moving. Now that's a very serious thing for us to kind of figure out. Listen, at this point there are no good teeth left, and we have to consider pulling all those teeth and having no more teeth left. Now what do? Once upon a time, if we did not have any good teeth left, we naturally went into a denture. But now we have a choice. We can do dental implants instead. And that means that you can have implants strategically placed in certain places, and then we can put crowns on top of that, and then you don't have to wear a denture. So number one, the second circumstance that we consider doing an all-on-6 dental implants are when we have a partial denture and we don't really have any more good teeth left. So one of the things that I dislike about partial dentures is that the teeth that support the partial dentures often get quite beat up. That means they are doing all of the chewing. They are doing most of the work in the mouth. And because they're doing that, they also have these clasps that grab around the teeth that are there versus the teeth that are not. So what happens is those teeth tend to deteriorate much faster because they're doing the work of 4 or 5 teeth just by themselves. Now sometimes a patient will come in, they only have 4 teeth, and the partial denture is being held up. 12, 15 teeth are being held up by 4 teeth. Now if one of those goes, let's do the math. We only have 3 good teeth left. If another one goes, we only have 2 good teeth left. And we have to make the determination if it's time to say goodbye to the teeth that we have remaining, and maybe it's time to start to consider that none of those teeth are good anymore and an all-on-6 dental implant may be a better option. And of course, the most common reason that we consider doing all-on-6 dental implants is because you wear a denture. Now, most people, I can't tell you how many times I have a patient, they have lots of dental issues, and they say, doc, take all my teeth out and just give me a denture. The reality is that most people who wear a full or complete denture are not happy. Now remember, if you've ever seen a denture covers the entire palate. That means it covers the entire roof of your mouth. That makes food not taste the same. Everything is much different when you're wearing a denture. You don't chew the same. It's not as effective because it's not natural teeth. You're not going to get the same kind of thing. And of course, you have to consider what a denture does also is sometimes it can come out. Now, depending on how long you've worn the denture will determine the quality of the bone underneath your denture, but have you ever considered that you may not have to wear that at all? Again, like I said before, once upon a time, if we decided that your teeth were no longer good, we had no good teeth left, and we pulled all your teeth and gave you a denture as a dentist, now we have better options. We can offer you something that is fixed, that does not need to come out. At night, you will not be placing your teeth in a jar. You will brush, you will speak with confidence, and you won't have to worry that food won't taste the same or you might laugh and it come out. So a denture is just one of those things that I hope becomes obsolete, and that's what dental implants do. They secure that denture, or in some cases, replace it altogether. So we've talked about the physical parts of your mouth that would cause you to consider to do an all-on-6 dental implants to replace all of your teeth. We talked about the fact that maybe you have gum disease and there are no good teeth left or very few good ones. We talked about if you're wearing a partial denture and now you only have a few good teeth or no good teeth, all of them are broken or they're cavities that cannot be fixed. Or if you already are missing all of your teeth and no longer want to wear a removable denture. Now, one of the other things that we have not considered are the social implications of why you would want all-on-6 dental implants for any of these situations. Number one, I think most people care is avoiding embarrassing situations. So I can't tell you how many times I've heard stories of patients who have been laughing in public and their teeth fell out, or they were at a gathering and their teeth fell out, or they, were speaking and they just were very conscious. Or I meet people all the time and they modify that the way they speak, they modify the way they smile, they modify the way they eat or the things they can enjoy eating, corn on the cob, apples, all kinds of different foods, steak, that they can't enjoy because they're afraid that their teeth are not secure enough or the chewing effectiveness is not as secure. When you do all-on-6 dental implants, it is as close to natural as you can. Your speaking will improve. You won't have a lisp because the roof of your mouth is covered with the acrylic material from a denture. You will be able to taste food better. You will be able to chew food much more effectively. There are so many social implications and just daily life implications of how all-on-6 dental implants or any dental implants can improve your quality of life. So those are some of the social implications. I always like to talk and think about family gatherings. Imagine if you're in a family gathering, you want to smile, you want to laugh, you want to be able to eat, you want to be able to sing, you want to be able to do all of those things and not be afraid that your teeth may come out, or you'll be uncomfortable enjoying some of the foods that you enjoy, or maybe foods you haven't been able to enjoy in such a long time. So that's another reason socially you consider all-on-6 dental implants. Let's take a look at this model one more time in a more detailed way. What you're looking at right now is kind of a downward view of a bottom jaw that has 6 implants that will be supporting an all-on-6 crowns. So you, like I said before, there's a clear model so you can see the dental implants, which you cannot see if you looked inside your mouth. And on top of them is what we call abutments. Now those abutments are used to support the crowns that will be either screwed on or cemented on in order to kind of put those in place. So even though you'll see that I'm removing the crowns, that is not really removable by you. So we will put them onto those 6 dental implants. You can see 2 towards the front and the middle and the back to support approximately 12 to 15 teeth. Now this is going to show more of a real life illustration of what all-on-6 will look like in your mouth. So you can see to your right, those are the crowns. I mean, that looks like there's real teeth underneath. And underneath, you can see those little studs, and that's just kind of that middle appointment where the implants have already been placed. And those little things are the abutments that we will use to connect to the crowns and secure them into place. Now the end result is gorgeous. Now this person has their lips peeled back and you can kind of see all the rim, but we use acrylic, pink porcelain and things like that. Sometimes we use something called zirconia, which is a very, very strong material, and that makes a very beautiful smile. You can see all the teeth are nice and contoured, and that restoration is a lifetime restoration. Those crowns are going to last you the rest of your life. And you can chew, you can smile, you can laugh, you can throw away those old dentures and kind of have a full mouth of teeth, any color you'd like, any shape you like. And really, this kind of procedure is life-changing. So again, this is all-on-6 dental implants. There's so many different reasons that we can discuss of why you may consider to do all-on-6, but again, this is a life-changing procedure. It will change the way you speak, the way you interact with others, and the way that you smile. So that's all about all-on-6 dental implants. Now, of course, those were in general terms. If you'd like to come to the office and we can discuss whether or not it is time for you to consider all-on-6 dental implants, that is something that we can discuss in our office and do an implant consultation, which we offer free of charge. Thank you for watching, and we hope to meet you soon.